Good evening. I'm so happy to be with you guys here again tonight on, I think it's day 13 that we're on now for the ASF Virtualpalooza. And I have been waiting for this one. I know that this session has been something that I've been really interested in learning more about as we all try to navigate the government benefits waivers and everything that goes with it. So we're so lucky to have our speaker tonight. But before we get to that, like always, I promised you every single night I would wear another t-shirt that I've gotten from someone in the community. And tonight it's my "This person loves someone with Angelman syndrome" shirt. I got this shirt like I think it was a year or two ago, and I love it. And I wish I could remember who I got it from, but I had to show it off tonight. And if you happen to be on the phone and you designed this shirt, let us know, because I'm sure a lot of people would love to see it and be able to get it. But it's an awesome shirt. So as always, we're so glad you're here. If this is your first night with us, welcome. Because you're with us tonight, we will also be sending you all a beautiful gift from the Angelman Syndrome Foundation in the next couple weeks of an ASF Virtualpalooza t-shirt. So we got to add to the Angelman swag that you have so you can represent and go out and raise awareness for Angelman syndrome. So that will be coming to your doorstep in a couple of weeks. Also, we have 2 more nights left of Virtualpalooza. It's been a wonderful 3 weeks with you all. 2 more nights tomorrow. We're going to talk everything about adult transitioning, adult living situations. And then the last night, we're going to have Dr. Lynn Bird from Wright Children's Hospital in San Diego to share a brand new tool that she's created that can go along with your IEP to help teachers, nurses, school personnel, everyone help to understand what Angelman syndrome is. So you don't want to miss those two. As always, we will record all these sessions and they'll be up at the end of the week. If you've missed any of the last sessions, they're already up, so you can go check them out. So we're so excited. I'm going to stop talking because I know you're not here to see me. I'm going to introduce my dear friend, Eric Wright. A couple things about him that you should know. One, the most important thing is he's married to the beautiful Debbie, and they have 3 amazing kids, Elise, Ella, and Ethan. It's hard, 3 E names, right? But they are amazing, wonderful family who have dedicated a lot of their time and their resources and their efforts to support the Angelman syndrome community. Not only is Eric a walk coordinator, not only is he one of our resource directors, so if you ever have any questions insurance related, he is there to help. He's also one of our board members. This family is truly beautiful and wonderful in so many ways, and we're so blessed to have them. And you're so lucky to have him tonight to navigate and help you walk through the world of insurance. So I'm going to pass it on to my dear friend, Eric. Eric, thank you for being here tonight.
Thank you, Amanda. How much do I owe you for that presentation?
Nothing.
Or did my walk just go up about another 25% for Louisville?
Right.
So, yeah. So folks, I'm just going to briefly stay on here on my camera for just a few seconds to introduce myself, and Amanda did a super job. Most importantly, I'm a parent of a child with Angelman syndrome, just like you. And so that's critically important for you to know that. Secondly, is that I do have 3 beautiful children and a wonderful wife, and I couldn't do this without my wife. I mean, she is the rock in this whole partnership of Angelman syndrome. And lastly, I just love this community. This is a community I love to talk to, a community that I love to support, and a community that I want to help. And so my journey with this started really when my daughter was born, and she's 14 now. Ssdi is a deletion positive, and she's just a beautiful little girl. So what I'm going to do now is I think best probably to turn my cam off maybe, but and then just shoot with the presentations. What I'll do that, and then I'll be taking questions from Amanda as she goes along. But tonight's goal is to educate you, to empower you to be able to understand, particularly Medicaid waivers, the most critical insurance piece that you're going to need throughout your journey. Private insurance is going to be a big part of that, but Medicaid is going to be a huge part of that. So let's turn my camera off here and let's get with the presentation, okay? So we're going to explore government benefits. We're going to explore the waivers, and we're going to learn a lot about through this stuff. But I've got to hide some things down here so I can see everything. So looks like we've got about 50 or so folks on here tonight. This is my daughter. You can see right here. We just recently went to an event at the Louisville Zoo, and they had these two beautiful wings and all the wings in the background. And I said, I can't resist. Let's get a picture. So there we are at the Louisville Zoo. Very fitting picture to start this presentation.
Hey, Eric.
So my background is, yeah.
Eric, I hate to break in, but you're breaking up a little bit. I know you have your video off, but we may have to also, because it's so finicky, you may have to remove your headphones. But I have quite a few people have said that you're breaking up.
Hang on, let me try something different then, okay?
Okay, thank you.
Let me try my audio in a different way. Okay, so let's try it like this. Is that better?
That's so much better. Thank you so much. We appreciate you.
Yeah, so sometimes computer audio is much better than your headphones sometimes. So, okay, good. Well, so again, this is my daughter, and this is me right here. So that's us, okay? And I'm an educator background, and that's what I love to do is educate. In a school counselor, and soon to be a licensed professional counselor as well. All right, so let's get started here. Say that from the beginning. Here we go. All right, so this topic is very important. I want families, friends, and advocates to really understand these benefits. We need information to advocate for access to government benefits to improve overall quality of life for families impacted by Angelman syndrome. And we need state-specific resources to help us navigate the system to access these programs from the state. I think that got cut off a little bit there.
Yeah, Eric, it's me again. There you go. I was about to say we couldn't see the next screen. Perfect. Now we can.
Okay, great. It's going slow.
It might be the connection, but we'll work through it.
Okay, great. Let's try this again. All right, so hopefully we're on the slide that says Angelman syndrome and federal programs. Are we doing good?
Not yet. Right now we're on the importance of this topic goals.
Okay. I'll just click slowly through here, and I'll just kind of let you talk about this. This is an important piece that I'm going to show here, and hopefully it'll work well. Let me know when it jumps to Angelman syndrome and federal programs.
I wonder if you would take it off presenter mode, if that would be better. Oh, wait, there it is. Okay, you're good. You're good. It's up.
Okay. So Angelman syndrome falls into the compassion allowance category for the Social Security Administration. And that's important because anytime you're thinking about dealing with the Social Security Administration, particularly when it comes to SSI, Ssdi, which really is very rarely necessary, more SSI, you will be able to approach your request that Angelman syndrome is already listed on the compassionate allowance. That's really important because it helps expedite your benefits through SSI. It is already a pre-approved condition by the Social Security Administration, and therefore, if they know that you have a child with Angelman syndrome, it meets that criteria. And by the way, the Angelman Syndrome Foundation and our team advocated for this placement. So it was the foundation that advocated for the compassionate allowance placement on the SS through Social Security Administration. All right, that should be on government benefits and SSI and Ssdi. Doing that, can you see that yet?
Not yet.
Okay.
You must just have a very slow connection.
I apologize for that. Seems like typically.
There you go. Now you are. You're good.
Okay. Great.
So it gives me kind of a review of the audience view when I'm looking at this. So with government benefits and SSI and SSDI, these are governmental-based programs which are designed to benefit the disabled. Both are managed by the Social Security Administration, and I'm going to give you this just to kind of give you some background. It's important to know the difference because the big significant difference is supplemental security disability insurance is only available to workers earning enough work credits with Social Security. Now, where that can come into place is if a parent becomes disabled, one parent in particular, their child then can receive some of the benefits through SSDI, which we'll talk about later. While supplemental security income, which as disability benefits are really based on income levels regardless of whether you've earned enough sufficient work credits or not. And so we'll talk about that. SSI becomes automatically available for a child with Angelman syndrome at the age 18 regardless of income. So I'll talk briefly about this. Make sure everybody's able to see this. This is just a kind of a flow chart of how SSI or SSDI eligibility comes available. So first, it's a verification of applicant's disability, and then you file a claim, and then you have to look at a recent work and duration of work test, and the verification that the individual has not reached normal retirement age, and then you have a 5-month waiting period. Again, this would be more related to the parent. If you're with your spouse this evening, or someone who qualifies as a joint income household, it's important to note this because this can become something later in life that you might need to be aware of should you need to take advantage of it. Average payments through SSDI on the lower level are $300 per month. On the upper level is $1,800 with a maximum of $2,861. Now I'm only going to present that slide and then I'm going to move forward with another. This is the big one. We're going to talk about supplemental security eligibility requirements. And there are 4 blocks here, and these 4 blocks are very, very important to understand. First, the individual that is receiving supplemental security eligibility insurance or supplemental security income needs to have $2,000 or less in resources. Now that's not just work income, but that is also anything that we placed in their name that would be valued at $2,000 or more. So you will hear things later about able accounts or special needs trust. Those things protect any asset that a child would have that would be above $2,000. And it can be very, very important because what happens is if you do carry something in that child's name, whether it be the bank account, savings bond, and Medicaid, and they're receiving Medicaid benefits, then Medicaid will recoup that money out of those funds if they're not protected. So that's supposed to say blind, disabled, bling, it could be bling though, or age 65 or older is how you receive the benefit, a citizen of the United States and a monthly income below $771. How are we doing, Amanda? Is everybody staying up with me?
Yep, we're still on the box with the slide with the 4 boxes.
Okay, we're moving ahead. Did that move forward?
Yep, good. Yep, it sure did.
Good. So it seems like it's sometimes the internet will throttle sometimes with everybody using so much around here. So how much does supplemental security income pay monthly in 2020? So this is in 2020, the maximum benefit is $783. Okay. But annually, there is a cost of living adjustment that occurs annually. Like last year, from 2019 to 2020, there was a 1.6% increase over the previous year, which brought us to 2020 783. Those are kind of projected out, year by year. So you can go to the supplemental security income page and you can kind of see what the expected increase in living or the COLA increase is going to be. And then it does have an increased benefit annually. So it's really important at age 18 you take advantage to ensure you apply for SSI. Now, there is a kind of a spin down rule. So this is a topic that a question I get asked a lot. How do you determine what to include in monthly expenses to your child? Well, obviously rent would be part of that. So rent income. You also have room and board. Board would be food. A proportion of a utility cost needs to be factored in there. What you're trying to do is justify, in reality, this is the reality, is that the expense of having the child with the disability that's in your home above the age of 18 in particular is beyond $783. All right, now, this is probably something I learned about. I learned about this benefit in Phoenix, Arizona at a conference. I was there. I talked with somebody from, it was actually MetLife. And we struck up a conversation. And I was told about the death benefit of parents when a child is receiving supplemental security income. And I started doing a little research and I said, these are considerations that you have to take in place as you start thinking about the future of your child. And so I'll give an example of a parent with a maximum benefit. This is like, so you're at a retirement age, you are drawing maximum benefit, whether it be maximum benefit at, if those change, maximum at 62, 65, and 70 typically is where you're looking at. I'm going to base this on a 70-year-old who's getting the max benefit through Social Security Administration, okay? Now, what happens, the child is disabled, there's a death of the parent, but another parent is living, or even if the parents both, if the parent who's providing the care for the child passes, what happens is 75% of the parent's benefit will then come to the child, plus the supplemental security income. So it can be up to, or the max supplemental security benefit, which would be, if we did this estimate at 75%, it would be $2,842.50 per month that the child would receive at the passing of a parent. Now, that's, it's a topic that we don't necessarily always want to talk about, but you do have to think about, I want to be able to protect those assets from, from the government. So the importance of that is those funds should be funneled into a trust or an able account where they are protected and it doesn't impact their Medicaid as well. This is a very, very important topic. We all have to make these plans. Now, I can't, so if you add those two together, you're looking at, $3,625.50 monthly. So if I may have said $2,000, but it's really $3,000, okay? So, and the total being no more than 150 to 100, and actually it's moved to 188%, but I saw another one that said 150 is or 180% is more than likely the case, but there are extenuating circumstances where they can get up to 188. I don't know that as much as being realistic, it's probably going to be somewhere at the maximum of the total family benefit. Okay, so just keep taking any questions. We can come back to these too, because I know this is like, okay, I want to make sure I understand that. So planning is critical. So let me give you some thoughts. You have an estate. Your estate is set up with a special needs trust. The trust is going, and the child is receiving Medicaid. And you want to make sure that those funds are protected. And you want to make sure that, your child has reasonable living accommodations. Including what would be provided through Medicaid, which we're going to get into, plus what would be provided by the trust, would be able to provide for the child past your life. How we doing, Amanda? We doing well?
Yeah, we're still on the example of a parent slide.
Okay, perfect, good. I'm moving ahead. Now, let's talk about Medicaid, both federal and state Medicaid programs. And really, so federal programs, we'll talk about what their mandatory requirements are for any federal Medicaid program which comes to the state. And then states do make some determinations as well. And so I've had the privilege for more than 15 years in the Commonwealth of Kentucky to be involved in something related to Medicaid. And right now I'm on the State Medicaid Advisory Council. So I've been involved with that, and I represent families that have children with disabilities. I've learned an extensive amount of information that I would have never had learned if I didn't step up one day and get involved with a program through ARC of Kentucky. And it was called Advocates in Action. And from there, I became a member of the Commonwealth Council on Developmental Disabilities, and then the Commonwealth Council placed me as their representative on the State Medicaid Council, and then the governor appointed me to the State Medicaid Council, and it just has moved forward and forward. And my term has expired, and I've been reappointed. And my term has expired, and I should not have been reappointed, but they just kept me on. So I just keep saying, sure, I'll keep serving. But in doing that, I've learned that each state does determine how these federal funds, are used to develop their plan, which is a state Medicaid plan. And the plan combines federal funds with state funds to operate the Medicaid programs. Now, it's important to note that each state gets 80% of their Medicaid dollars from the federal government, and they must contribute 20% to the Medicaid plan. Now, there's been programs like Enhanced Medicaid where it's been 90-10, or there's been special programs like you could have a program where it could be they're trying to get people out of institutionalized care, which could be called Money Follows the Person, where it's 100% of those funds come directly to the Medicaid recipient to get them out of institutionalized care. But states must adhere to very stringent federal guidelines in this operation. And I have reached out to my federal CMS person, which is the Cabinet for Medicaid Services, and argued some points about some things that were taking place in Kentucky to advocate that they were wrong. And I would encourage you all always to be able to reach out to anybody who's an official to be able to get guidance and direction. And you can find out information about state-by-state programs by this website here. I'll leave that up if you want to just take a few minutes. It's medicaid.gov/state overviews, and then you have to put in /index.html. What that will do is it'll tell you all of the Medicaid programs state by state, so that you can understand what is available in your state. Now, Medicaid waivers is an area that I have just become an expert on. And it's just because I'm very passionate about understanding waivers and how they impact individuals and their families with Angelman syndrome. And individuals with Angelman syndrome qualify for Medicaid waiver programs. And it's important to note they are not income-based. Now, they might be age-based at times, so you may not qualify for a certain waiver program until age 18, but there's important things that we'll talk about, specifically wait list and understanding how you need to be on a wait list, particularly for you young parents out there with young children with Angelman syndrome. The quicker you get on that wait list, the quicker you will be able to gain services. And so get on that list. It takes a little bit of work, but it's worth the hoops you have to go through. These programs are offered through what's called Home and Community-Based Services, which are 1915C waivers. And you can learn about those waivers by this link here. I'll leave that here for a second. And Amanda, is there any possibility we could copy those links and put them into the chat?
Yep, sure can.
Awesome. I was just thinking about that. I think I might be able to do that. I can't while I'm in presenter mode. but I don't know.
I'll do it. I'll do it so you can go on. Yep, no problem.
Okay, great. So I'll go back to the previous one. So let me go back here. There's the one that's this one here too, the state one, Amanda, and then this one here, which is about the 1915C.
Okay.
You tell me when I'm good.
You're good.
Okay. Yep. Okay, cool. Now, I love to get to talk about the levels of waivers, waiting list, and advocacy. This is where you have to put your advocacy hat on. And you have to understand the level of waivers. So I give a really decent analogy, I think, to understand how these levels work. So states provide levels of care for families and individuals with Angelman syndrome with various levels of support. So if you're thinking about, okay, I'm really thinking about how I can get a daily, a daily allowance for residential services, which is available, like it gives a daily rate for residential services, and that means like for them to live in a residence with care. You're going to have extensive long waiting lists, and sometimes the reality is those waiting lists don't come available until the death of the primary caregiver, which can be the parent. It's not always the case, but for example, we have a 17-year-old daughter who has CP, not Angelman syndrome. We adopted her from Ukraine when she was 17 months old. Her name is Ella. We got her on the waiting list for the waiver when she was, so we started receiving waiver services at the level 1, okay? All right, and then we applied to be on the waiting list for the level 2 and the level 3 at the same time because she qualified, but we weren't able to get access to those because of extensive waiting lists. So, but you keep your name on the list, okay? Now, we've moved from level 1 to level 2 with her and with Elsie now too. So we're at the level 2. So we've gone from level 1 to level 2, and we're on the waiting list for level 3 services, which is residential services. Ella's been on the waiting list for level 3 for 14 years. It's not to say that, and it does include additional services beyond residential that's a little bit higher level, like you'll get more respite hours at the level 3, okay? But it's important, I just want to emphasize, to get on these lists as soon as possible. Whatever level you have within your state, you want to start with the lowest, get on Medicaid. It's critically important you get on Medicaid. Then get your name on the level 2 and the level 3, whatever it may be within your state. Sometimes they'll call them something different, but just understand that there's a hierarchy of levels. You want to be on the highest level that you can think of. And again, it's important to say you can be receiving level 1 services, which is important because you're in Medicaid for insurance, which is part of the waiver program. You're getting Medicaid for insurance, but you are also later going to get some additional supports through Medicaid as well for community alternatives, which is, we'll talk about that in a little bit. Now, let me give an example of level 1. Think about a car. Okay, level 1 is like this. A level 1 waiver is probably a lower level, inexpensive car, maybe like a Kia. Now, it's not the high-end Kia, it's a low-end Kia. It's functional, it gets you point A to point B. Okay. Level 2 is a step up. Maybe it's a sedan, 4-door, might have a CD player. It's got all electric, and it's made by Honda. We'll just say that's the Honda level. So we got the level 1 being the Kia, it's functional, get to A to B. Honda, you get a step up, you get a few more little things. And then level 3 is like the Mercedes of waivers. And when I say that, it's an analogy I want you to put in mind, because with the Mercedes, they're typically going to come loaded with all the options, so that you will be able to have the best options for the most amount of comfort, right, and luxury. Now, I hate to use the word luxury with that, but it really is about trying to build quality of life for your family and your child. And waiver names vary state by state, and you do need to do your research. Like the Katie Beckett waiver is a very common waiver within the South. You'll find it in Georgia, you'll find it in North Carolina. It's related to an advocate, Katie Beckett. And then we have the Michelle P. waiver, Michelle P. was a Medicaid recipient that was not getting the level of services that her grandparents need. They sued the state in 2006-07, and they won, and therefore they won their right to be able to include more supports and services and get people off the waiting list here in Kentucky, and therefore the name Ssdi Waiver. We are on the Ssdi Waiver waiting for the supports for community living waiver.
Eric?
Yeah.
A question came in that asked, how do you know what level you're on?
Well, that would be probably a case manager, or you can even, we'll talk about resources within your state that you can call. A couple of those resources in your state that you can actually call to find out what level of support that is with your waiver is you can call your state protection and advocacy. So if you just literally type in your state, for example, let's just use New York Protection and Advocacy. That's a federal funded program that's sole purpose is to protect and advocate for individuals with disabilities. Often the case, if there's ever any legislation, for example, our Ssdi Waiver example, the lawyers of protection and advocacy filed suit against the Commonwealth of Kentucky to ensure that there is going to be support and services for individuals with disabilities. So that's one agency that can help you. Another really important agency is the ARC chapters within your state. ARC is an acronym. It's an antiquated acronym. It used to be Advocates for Retarded Citizens. Now we don't use that terminology. Obviously, that is not compassionate. It's not. It's something that would be offensive now. But they just become the ARC now. But the ARC chapters in your state can help you with parent-to-parent programs. They can help you because they actually have parents in those states that have worked through these levels. So that's where you would start. You can also do your research on the websites that we provided, and you can find out what level it is based upon the name of the waiver that you're receiving too. So just do your little bit of research, make a few phone calls. One other place that you can get help is University Centers for Educational Excellence and Developmental Disabilities. They're called UCEDs, and I have that slide later. I'm going to show you guys that too. But those are great. It's a great question, and those are the places that can help you find out what level you're on. All right. Now, services provided by most waivers include the following. And here's my respite care, which means you are able to be provided respite care to be able to get out into your community. Now, currently we're in a pandemic. Many waiver programs have been influenced or impacted by state of emergencies. We'll talk about that. So respite care may not be available because they're not bringing people into the homes that are care providers, and that could put a little challenge. But respite is something that allows you and your spouse, or you just yourself, to have a little respite away from your child to be able to get out. You get to hire somebody to be able to come into your home. Personal care support is approved. Attendant care. Attendant care is really care that's designated for an individual who may need some care while the parent is working. Now, services are provided by higher level waivers can include, or may include, at the level 2, community living supports, job coaches, case managers, environmental supports like home modifications. Yes, that's correct. The Commonwealth of Kentucky, you can get a $500 once a year home modification grant through the waiver, or you can actually get $500 to pay for an iPad. It's an environmental support. So we have done this a couple times and had success, and at other times we meet a little resistance, but then we just call somebody and they help us through it, okay? Now, services at the highest level includes all of the above in 1 and 2. There are the level 1 and level 2, but additionally includes payments for residential supports along with funding for 24/7 residential care, including staffed residences. So that's the highest level you can get. Now, sometimes those staff residences need to be supplemented, and they are supplemented by supplemental security income and by benefits that would come to them at the passing of a parent, or through trust, or through the ABLE Act. we'll talk more about that as well. Am I going to do it fast? Everybody let Amanda know if I'm doing okay by just chatting in there and saying yes, no, slow down.
Doing good.
Okay, good. There's a lot of verbiage here about waiting lists, levels. The focus of the home and community-based services waiver is to provide support and services within the individual's community as much as possible, not in a residential community. The OSED Act really said, hey, look, you cannot continue to place individuals in residential institutions. So it requires community states to provide community alternatives. And there's two ways to be able to have those services, potentially through a traditional provider, which is an agency who coordinates care along with supports services. Now, what we do person-directed, which allows us, or the individual, should they be able to, and a representative to coordinate supports utilizing their own budget to hire. So I can hire people, I can train them, and I can fire them. And I can do that from people I trust as long as they're 18, have CPR and first aid, and a clean criminal record check. So I can hire my mom. I can hire my wife if I'm the representative. I can hire friends. I can hire neighbors. I can hire people to go to church with. I can hire teachers, which we've done. You are able to bring them into your home through person-directed services, person-centered services, and you can have them be paid a reasonable wage, typically somewhere around $20 or above. Typically around $20 in most states will get you $20 an hour for what you need. And the purpose of person-directed, the purpose is to allow the individuals with support really direct their services. Like they get to choose. It's a choice issue. And parents get to help choose that plan, regardless of how the plan of care is often developed through it's really through a person-centered planning process. Planning is key, and Medicaid waivers are critical, you all. They're critical to this planning process. All right, so there's some additional Medicaid information that I think is really important to know. So waiver eligibility varies by state. Some states apply 300% above the federal poverty rate. For an example, a family of 5 would be $92,040. But most of it is considered deeming. Medical or institutional deeming is another criteria which is often used. For example, if this individual is deemed to be medically eligible, or there's going to be institutional deeming, it's to keep them out of institutionalized care, then states follow that rule, and states really consider a child under 18 as if they're in an ICF-MR facility, which is an institution. ICF is the institution for it's a institution for critical MR is institution. Mental retardation is what that was, ICF-MR. But just think of it is as long as they would be someone who would typically be in the past considered to be in an institution, the state will say they're deemed eligible for the waiver. And they don't count parents' income or assets. Everybody hear that? Medical deeming does not count parents' income or assets. So you qualify for Medicaid either by the 300% above federal poverty rate, or if your state utilizes a medical deeming practice where they do not count parents' income or assets. So most likely, both children and adults, this is the case in most states. I've done the research. Most of the states, both children and adults qualify for waivers based on income or medically institutionally deemed. So they're going to look at both of those, but the reality is children and adults qualify. So children under the age of 18 can qualify for Medicaid services. Now, guardianship becomes important. This is our guardianship year for our oldest daughter. She's 17, and it's an important topic at age 18. You know, we have to apply for guardianship for her, and we will go through a court system approach. And each state has very specific procedures for applying for guardianship. So some states require you to retain the services of an attorney. Some states bring you to court and you get free representation. The state of Kentucky is great. We actually have, we're fortunate enough that we receive some services through the Commission for Children with Special Healthcare Needs, which is another Medicaid program. We will have the social worker there contact us because she turns 18 in March. They'll contact us in January, maybe probably even December. We will, if pandemics included, we will go through the whole process virtually. All right, now let's talk about the pandemic real quickly, because it's important that if you're receiving Medicaid services right now and you're not able to use services and supports that's part of your plan of care, you can, under some emergency declarations, increase the amount of care that's being provided in the home if it's being provided by a parent. So, for example, let's say that you were paying someone 30 hours a week to take your child out into the community, but due to the pandemic, they're not able to take them in the community, and that requires the child to be in the home much more. Well, that requires the parent to be providing more care. And if your state allows for parents to be a provider of care, particularly personal care, and you have a representative, you could potentially request to have overtime during the pandemic. You need to check with your case manager because it does change state by state. It's important to be able to know this stuff. Yeah, go ahead.
You're good.
Okay, cool. So how am I doing with time? Okay, I got about 20 more minutes, right,
Yep.
Amanda?
Yep.
Okay. All right, so other Medicaid programs I want you to be familiar with because it does impact insurance. Remember, Medicaid's not just the stuff I was saying about respite, personal care, job coaching. Medicaid also has insurance. It's an insurance that you have for your child. So state Medicaid plans include other components which are important to consider. Some programs are specific for children, and some programs help just families overall. So here's mandatory federal benefits to consumers of Medicaid. You see them right there. I'm not going to read them all to you, but you can see them. Amanda, can you see all these?
Not yet.
Okay, I'll slow down.
While that's transitioning, someone did have a question. If you understood, or if you knew where to look on which states right now can change their coverage because of the emergency crisis, or where would they just need to talk with their case manager?
That's a good question. So many states, if their Medicaid office has put up COVID-19 responses on their state Medicaid sites. So
Okay.
they go to like their state Medicaid, and they can check like what type of response has been provided through COVID-19. And I'll give an example. You give me a second at the end of this, I'll flash up a quick website that Kentucky has.
Okay, perfect.
Yeah, it's great. But the reality is just a little bit of research on the computer can let you know if there's been any, changes to how those services could be rendered, or utilized. But I mean, it's not what we want. We would rather have our, children to be in the community. And I see the posts of families out there, that it's like, this is a really challenging time. But if there's a benefit that you could, get from it, my philosophy is get it.
Yeah.
And improve your overall quality of care. So are you able
Yeah,
now to see the mandatory federal benefits to consumers by having Medicaid?
we sure can.
Okay, so these are just things that are just like, so if you receive Medicaid, no matter what type of level you're on, level 1, level 2, level 3, these are mandatory. Physician services are mandatory. Hospital services, X-ray, early periodic screening diagnostic treatment services for individuals under 21. That's huge. We're going to talk a little bit about that. But all of these things are mandatory. Keep going backwards. So these are optional. So states don't have to cover prescription drugs. They're not required. Many of them do. States don't have to provide dental and vision services. Do that, but they still provide physician. They have to provide physician services and hospital services, but they don't have to have dental and vision included. They don't have to provide prosthetic services or clinic services, physical therapy, primary case management, but much of that is covered. Like case management is covered under the waiver typically. Nursing facility, immediate care facilities for individuals with mental retardation. That's where it's immediate care facilities. That's not covered, but the waiver does. So having the waiver are things that are covered, and if you bundle, because you get the waiver as being on Medicaid, you're getting the Medicaid waiver, and therefore you get Medicaid. But you may not get all of these, but many states do get these programs. Now, children. Medicaid in children 0 to 21, which is EPSDT, which is Early Periodic Screening Diagnostic Treatment Program. So right before you came on, Amanda and I were having a conversation about services that may not be covered. Like, let's give a very definitive, say it's a specific seizure medication for a child. We use the example because my daughter's taking Onfi, right? And she's 14. And Onfi is not covered under my primary insurance because I work at the University of Louisville, and the university says, we'll give you the generic for Onfi, but we're not going to give you Onfi. Well, as long as my pediatrician, who in this case is Ron Peter, writes a script that says, as Elsie's neurologist, we are saying Onfi is medically necessary for her. In the state of Kentucky, EPSDT has to abide by the medical necessity of a physician. It has to go to EPSDT, and they have to review it. But in our case, Onfi is covered by Medicaid because the doctor wrote a script. Now, this is where it gets really. So let's go think about the federal required, the state potential, right? These are state optional. But let's say there's something that is considered to be medically necessary. Now, I can give you 100 examples. I'll give you 5. A wheelchair, a special trip trap chair for feeding, a communication device, okay, a standing, it's a standing chair or a walker, right? And they're not covered under your primary. They're not covered under state Medicaid. If you get a doctor in your state and you have a child under the age of 21, you give it to your EPSDT program. The doctor's script will allow you to get that benefit. Now, this is a big one that comes up often too. Amanda knows this. Beds. Like if there's a medical necessity to a bed for safety of a child under the age of 21, and you have a doctor's script, probably going to need to be supplemented by another therapist as well. So you get 2, you submit, and in all likelihood, you will probably receive that bed. Everybody heard that? All right. It's not 100%. I didn't say 100%. Probably likely because sometimes states will push back a little bit. You just got to keep pushing forward. Okay. Then you have to call protection advocacy and say, why am I not getting this bed? So if I had to describe EPSDT, this is kind of a Kentucky example. And while there's no federal definition of preventative medical necessity, Federal amount, duration, and scope rules require that coverage limits must be sufficient to ensure that the purpose of the benefit can be reasonably achieved. So you got to understand that. Since the purpose of EPSDT is to prevent the onset of worsening of disability and illness to children, the standard of coverage is necessarily broad. So it's big. And the standard of medical necessity used by a state must be one that ensures a sufficient level of coverage that not merely treat an already existing illness or injury, but also to prevent the development or worsening of conditions, illness, and disabilities. So like, you can justify it by a letter sitting, and you can justify it by research that the Angelman syndrome has been pivotal on communication, or Aaron Sheldon has proven to be that my child needs to develop a dynamic display device so they can have a dynamic communication system. Therefore, we need to be able to purchase an iPad with ProLogo to Go or Pod or whatever it may be, because this is not, it's going to prevent the worsening of the condition. Or my child's safety is jeopardized at night because they will roll out of bed or wander the house or go to the door and potentially leave, all of those things, right? You just say that this is going to worsen the condition if we do not get something that can help us with that. Now, I suggest to anyone, standard sleeping is good. That's me getting on my own personal thing. So trying to get them to sleep in a bed, it takes a lot of time and energy, but it can happen. All right, this is another huge one. So we talked about EPSDT for 0 to 21. Medicaid HIT programs are huge. They just recently been enacted within the last, 15 to 20 years. It was really part of the Omnibus Budget Reconciliation Act of 1990, but then they started to really kind of get into developing HIP programs, which are kind of not known people within the last 10 years. HIP stands for Health Insurance Premium Payment Program. It's a Medicaid program that allows a recipient's family, my family, to receive free private health insurance paid for entirely by their state's medical program. So, my daughter has Medicaid. We have a really nice health insurance. My premium, I'm going to give you a 100% example, is $590 a month for us to be on this coverage. Kentucky wants me to keep that primary health insurance because I have a daughter who, if I didn't have primary, would increase their actuarial or their monetary outpour for services for both our daughters. So they pay my premium for my health insurance. Now, there are some rules to that. It must be a large group plan, and it has to be, it can be self-funded through the company, like a self-funded large group plan, or it can be, it doesn't have to be. So I worked for the state of Kentucky as a school counselor before I went to the University of Louisville and started working, and they pay for it there. They actually, when I made the transition, because there was a short transition, but by the time I left my previous job and I had to pick up COBRA for a brief period, they paid for my COBRA. So, because I was transitioning between school year and to the start of the year at the University of Louisville. So a Medicaid recipient must be deemed cost effective, though, by HIP, because they'll do an actuarial review of that. Did y'all get to see that? Okay, good. All right. We're in the home stretch here, and we're going to get wrapping up here so we have some time to answer some questions. Amanda, how much time will I have for questions?
We'll be able to answer most of them that came up, so we're good.
Okay, good. Let's talk about insurance, which I've talked about now, Medicaid, and then let's talk about the Stable Act. Stable Act is it's a modified 529 rule to 529A, which is Achieving a Better Life Experience, or ABLE Act. which allows up to $14,000 per year to be saved into an ABLE account annually for a child. It protects supplemental security income payments with a threshold of up to $100,000 in most states. So that means that you can receive SSI, you could still be putting money into an ABLE Act. That money can be there to help provide some resources for them in the future, and Medicaid's not going to take it. So they're protected. Now, this is the caveat. At the beneficiary's passing, which is the child with a disability, state Medicaid programs have the option to recoup Medicaid expenses out of what's left in that account. This is where it can be interesting. Like, I have 3 kids. If I put money into an ABLE Act and my children preceded my son in death, then the state of Kentucky could come take whatever money was left in that ABLE account for my daughters if they chose to. They don't have to, but if they chose to, they could by that law. So we chose to do special needs trust versus an ABLE Act in our situation. Okay. But there is benefit to the ABLE Act because it is a way to supplement their SSI payments and other needs beyond Medicaid as well. Now, I also want to give some information about just like advocacy and agencies, because I will scream about advocacy. I love advocacy. And we talked about ARC of the US with state chapters, which is tremendous to families. The state councils on developmental disabilities are federally funded, are there to help families with children or adults with disabilities. Your protection and advocacy councils are federally funded and there to protect families and advocate for families, and they do have attorneys as well. And the University Centers of Excellence in Developmental Disabilities, Education, Research, and Service, or therefore known as USED, is federally funded as well. Now, here's the one thing I could tell you about the future of Medicaid. There are 3 things in life that I believe are constant, truly. All right. Change. Change is coming, but we're not sure how it would impact individuals with Angelman syndrome. So just be aware, keep up with it, because what somebody tells you today will change with Medicaid tomorrow. And it's important. Typically, Medicaid's trying to do 2 things: improve, but to save money as well. Choice. Advocacy, you have a choice. Sorry, I lost my audio connection there. Are we okay?
You're good. Yep, you're good.
Choice. We have a choice to advocate. Advocacy is standing up for those who may not be able to speak for themselves. Like, don't have them, so if people are making decisions, it's nothing about us or our children without us. Like, they're not going to start me. You got to go with the philosophy. You can't make this choice about these programs without talking to us. There's not people that sit in silos and make these decisions that have been there to support families and their children for years, or individuals with disabilities with years. And the last is just the principle of, what is your story? So just know what your story is, so that when you get a chance to advocate about what's taking place with your family, be able to know what your story is and be able to give that story, tell that story, and make sure people are aware of your story. Any questions? We got time to share a little bit now, so I'll lift that up here. So we will be able to take questions, and I'll do my best to answer every question. If I don't know the question, we'll just keep a record of it, and I'll get back with you.
Thank you so much, Eric. So much information, and I think it's one of those things that you can never really cover within an hour. So I'll ask some questions, but I also just want to make sure that you guys all hear and know that if you need to speak with Eric or anyone at the foundation one-on-one to kind of help you through some of these processes and through some of these questions, make sure you reach out to us at info@angelman.com, and we're more than happy to help you and walk you through that process. So a few questions here. I'm going to kind of go all random here. One, just so you guys all know, The slides will be uploaded, so will the presentation to the Angelman website. So a lot of people ask that, so stay tuned for that. Someone asked, this is a newer, it looks like a newer individual with Angelman syndrome, but they were told by their regional center that their son was placed on a state waiver. Is that the same as Medicaid?
Yes, regional centers are in California. Is this person in California?
I don't know. It doesn't say. But
yeah, typically from my past experience, we're probably talking about a California parent.
Yes, she said yes.
Yes, and regional centers are exceptionally good. California is an exceptional state. So if they were placed on a waiver, then they're in good shape.
Perfect. And the next question is, I don't know if you can answer this, but this was asked actually a couple times, that how often can you replace a bed with Medicaid or waiver dollars?
Good question. Typically, the threshold is around, that for that return to be able to go back to them, it's about a 5-year period.
Okay. And what happens with the coverage once, you kind of talked on this, but I think you talked on this, but there's so much to it, it's hard to remember. When an individual turns 21, what happens with that coverage?
Well, that coverage becomes a little bit more challenging because the PSDT does not continue past the age of 21. So it is hard to be able to get a bed, harder through state Medicaid dollars after the age of 21 if you're looking for a safety bed, because it's not going to be something that they would be covered under EPSDT. So remember, EPSDT allows a very broad definition of medical necessity, but it only goes to age 21.
Okay. And then this question is very related to what's going on right now in the world. The question is, due to medical reasons plus COVID, my daughter cannot presently attend her adult day center or have a care provider. With not using her IO waiver right now, is she in danger of losing it?
That is a great question, and my suggestion is that if that is something that's being told to her, she needs to, call protection advocacy. And I don't know the state, I don't know the circumstance, but a state would be, they would not be following what I would be is the philosophy of Medicaid is community alternatives. If there is we're in the middle of a pandemic, it's kind of unprecedented times. States are enacting emergency protocols and procedures. I would suggest she calls her caseworker and reviews those emergency procedures. There is a chance that if she's a care provider, could be able to receive a little extra income in her home if she's providing care that would typically be going to an adult day center.
And then the question came in of, can you claim Medicaid if you are covering your child on your job insurance?
Can you claim Medicaid?
So I think this is the question of, like, for us, for example, for our family, we have a primary insurance through Adam's work, but we also have Medicaid.
Yeah.
So maybe I think that might be the question they're asking.
So there might be two things that I might be able to help people with, and this is a great topic. I should have included a slide on this. First, if you are a recipient of Medicaid dollars in the home and you're a provider of care, like let's say you're receiving money to provide personal care for your child. Perfect example, maybe it's the husband as the representative, doesn't have to be the wife, for example, who's the representative of their family, and the wife is receiving income to be able to provide that personal care for their children. Those dollars are completely tax-free dollars, so you don't pay taxes on that money. So if that talk about claiming, you don't have to claim any income that comes into your home through Medicaid dollars and it's providing care, as long as it's someone who's living in that home that's providing that care. So if there's coverage through Medicaid and you don't want to have to you won't qualify for HIP so like if you want the health insurance premium payment option where you might be able to see if you have premium coverage, like you get your premiums covered through your work insurance, you would have to have your child covered through your primary insurance to be able to get that. If you don't choose to, like for example, if you want to cover just husband and wife and the children, and you have a child that is going to be covered by Medicaid, you don't have to cover them, but you will jeopardize HIP if you're trying to get HIP.
So maybe that's if this individual or anyone needs a little bit more clarification for that, would the best place for them to go is to a case manager, or who should they consult with?
I would check first to see if the state's offering a HIP program, and then have their case manager. You can find out who the HIP, which is the health insurance premium program coordinator, is within their state. Have your insurance and an actuarial analysis of the care for the child or the adult for that matter to determine whether it would be less cost prohibitive for the child to be covered through private insurance, and therefore they pay the premium. So it's tricky a little bit. HIP is a tricky one. I've had a lot of success advocating for families in the Commonwealth to at least get them on HIP, but like for example, I have a really close friend. They have a daughter that has autism, and his company doesn't meet the criteria because it's a small company. So small business typically can't get HIP coverage. So it's a large group plans typically.
Interesting.
Yeah.
And then the last question we will end with here is, and this is a question that comes up a lot, and maybe you can share your experience and what you know, because this is probably a state by state thing.
Yeah.
But it comes up a lot of, how do you get Medicaid to cover doctor visits to Angelman clinics if they're out of state?
So, I've done it and it worked. So we go up to Boston, and we have primary and secondary. And you remember, this is a federal program, and it's going to vary state by state though. Remember, but physician services are covered, but it's tricky. They have to be a Medicaid provider. So like, for example, some large hospitals are federal Medicaid program providers. Some of them are state Medicaid providers. Therefore, they don't all carry the same distinction. So one clinic may just be able to bill state Medicaid dollars, where another can bill state and federal Medicaid dollars. So you have to be aware of those things. However, most clinics that we have out there are large enough clinics that private insurance should be able to help with that. It might just be out of network. So it might be that they're not paying the in-network. There might not be the in-network reimbursement, but it might be out of network reimbursement. So there could be some cost to the families, yes. State by state, hospital by hospital, clinic by clinic.
Yeah, and so just so you guys know, because this is a question that comes up at the foundation often, is we're going to be launching a brand new 15Q clinic network site. So it's all about our clinics. And what it will do is every single clinic will have its own kind of page. And what you can do is go to that page and find out everything about that clinic. So what age range they see, what specialties they have, and also some different information on insurance, because this is a question that comes up all the time.
Yeah.
So we want to make sure people know that, one, what to expect, but also we can help you through that insurance process, that if you are getting, we can't promise that you're not going to get charged anything, but the goal is to try to make this as easy as possible for families when it comes to the clinics.
My thought would be on that possibly, Amanda, is too, if we could find out if they've had, like if they could give information on the states that they're able to bill and successfully recoup through Medicaid, that would be typically just asking maybe their billing office, whoever it is, for however they bill. Can you recoup payment for services rendered through which states can you work with and have you worked with in the past? Be great if we could include that. It wouldn't take a lot of work, and I think it would be very helpful.
Yeah, because it's a question we get very often. because so many families want to get there, but there's
Yeah.
costs. So, and just to remind everyone that's on the phone, the Angelman, the ASF Family Fund was originally created to provide resources also for families to get to clinics. So we can get you there and help cover costs to get there. And then the goal would be to try to get the cost of the actual visit covered as well, to make it as an easy process for families as possible. So
That's awesome. Awesome, awesome, awesome.
So any last words of wisdom, Eric, as we wrap up the evening here?
As a parent, my wisdom is, and it's like that self-care that's the counselor in me, is every day do something that gives you pleasure. And here's 3 things. One thing that you could do, like in the morning, that gives you pleasure. One thing that you could do that takes, and so think about that, less than 3 minutes. Okay. All right. One thing that you can do that gives you pleasure that's physically active, or gets you out in the, in moving. And the other thing is, try to accomplish one thing and don't beat yourself up if you don't. The biggest challenge I think parents have in the Angelman syndrome community is this fear that they're not doing enough. And I can absolutely attest that we do the best we can. And you just know that we support you in that effort.
Absolutely.
100%. Yeah.
A lot of people saying in the question box, thank you to you, Eric. That's a lot of information to take in, but like I said, if you have individual questions, or if you just need to talk this out with some individuals, especially if you're newer into the process, or if you're moving into a new kind of wing of the insurance and the waivers, like a new kind of area, feel free to reach out to us, and we will do our best to be able to support you through that journey.
Yes.
Thank you guys so much for being with us tonight. Hopefully we'll be able to see you guys tomorrow night. Just as a reminder, tomorrow night we'll be hearing from 2 amazing individuals who have walked the walk of transitioning their children in different ways in different living situations, and how they've gone about doing that. So if you have an individual who is older, this might be a great session for you, but just information for anyone, it's really important to have as well. So thank you guys so much. Thank you, Eric, for being with us. Tell Debbie thank you for allowing us to take her away from you for a couple hours.
We can all give each other virtual hugs.
Yes, virtual hug, and we will all see you tomorrow, and stay healthy and stay well.
And we'll see you next year in Texas. Every one of you all in Texas.
Yes, for the family conference. Absolutely. Good night, everyone. We love you.
Take care.
Bye.